Good morning, everyone. I'm Crystal Gennick, the pharmacy manager here at Health Plus Pharmacy. On behalf of our entire team here, I just want to welcome you all and thank you all for being here today. We take great pride in being a trusted and important part of our community here in Windsor Park. Our pharmacy has had the privilege to serve this incredible community for over 11 years. And I know for myself and the rest of my team, Shorin, the co-owner of the pharmacy back there, and our two incredibly wonderful pharmacy assistants, Carrie and PB, this is so much more than just a job for us. This is our passion. Our goal is to accommodate the needs of everyone in this community and the surrounding areas by not only providing the usual and standard pharmacy services, but also making available other services such as compression stocking fitting, flu shots, COVID vaccines, and now rapid antigen testing for travelers. With that in mind, I'm incredibly excited that Minister Gordon is here today to receive her annual flu vaccination. I will now turn things over to Minister Audrey Gordon, Minister of Health and Senior Care.
Good morning, everyone, and thank you, Crystal, for that introduction and for hosting us at the Health Plus Pharmacy. I'm Audrey Gordon, Minister of Health and Seniors Care, and I'd like to welcome everyone here to the neighborhood of Windsor Park, which is part of the Southdale constituency. I would like to extend thanks to Dr. Roussin, our Chief Provincial Public Health Officer, and all the clinicians, pharmacists of Health Plus Pharmacy, and special guests for joining me here today. Today, I'm pleased to be here to encourage all Manitobans to embrace winter wellness, to stay well and get a flu vaccine to help protect themselves and their loved ones. Overall health and wellness has never been more important than it is right now. Getting a flu vaccine is the most effective way Manitobans can protect themselves and each other from the flu. It means fewer people getting sick, fewer people who miss work or school, and fewer people who need to be treated in a hospital. This winter wellness campaign encourages all Manitobans to commit to simple lifestyle activities that will help keep people active, eating healthy foods, reducing their stress, and getting the flu vaccine. It is important for all Manitobans 6 months of age and older to get immunized against influenza. Once again, the 2021 campaign will be targeted to those most vulnerable and their caregivers, including specific outreach to healthcare sectors and the public service. Last year, a record number of Manitobans got the flu vaccine, and our government is encouraging all Manitobans to do so again, or get it for the first time, if that is the case, especially those with increased risk of serious illness from the flu, their caregivers, and close contacts. We also encourage Manitobans to continue practicing the fundamentals, staying home when you're sick, practicing good hygiene, covering your cough, and physical distancing. Let's all work together to lessen the impact of the seasonal flu on our healthcare system. Thank you.
Well, good morning, everyone. Thanks, Minister Gordon and Ms. Gennick for hosting us here today. There are many ways for us to try to keep ourselves healthy during this upcoming winter. Certainly it can be difficult with the weather and with some of the public health restrictions, but staying active throughout the winter is a great way to improve both our physical and mental health, as is eating a well-balanced, healthy diet. Social interaction is so essential to our health, and it's been quite strained during these last 18 months, so I encourage people to stay connected with those that you care about. finding ways to stay connected, of course, following the current public health orders, following those fundamentals that we've been talking about for the last 18 months, but do what you can to stay connected this winter season. The seasonal flu vaccine is another way to help stay healthy this winter. And of course, that helps us. It helps the people around us, the people we care about, and helps other Manitobans. So I encourage all Manitobans who are eligible to get that flu shot this year, get it as soon as it becomes available to you. It's a safe and effective way to prevent yet another respiratory virus that we're facing this winter. So this is certainly more important, or significantly quite important to those at increased risk of severe outcomes, those over 65, those under 5, those with underlying medical conditions. So very important if you are one of those people, if you care for one of those people, if you come in contact with them, to get that flu shot and to get that early. It's always difficult to predict what kind of flu season we'll see, and this year is no different. We do know that COVID is still here, and if we have influenza circulating at the same time, that's going to again put that strain on our healthcare system. So if you're not already vaccinated against COVID, I encourage you to do so as soon as possible. Encourage you to get that flu vaccine if you are eligible as well. This is just yet another way that we're working together as Manitobans to keep us all healthy and to protect that healthcare system for everyone. A record number of Manitobans got their flu vaccine last year, 31.6%. So certainly I encourage all those people to once again roll up your sleeves, get the vaccine this year. And everyone who hasn't had one in the past or wasn't able to get one last year, I encourage you, if you're eligible for a vaccine, Manitoban 6 months and older, get that flu shot as soon as you can. The high-dose flu vaccine, formulated for those over 65, will have almost twice the number of doses available. So we've expanded that criteria as well. So Manitobans over 65 years old, over 65, should also get that pneumococcal vaccine. So this is typically a one-time vaccine. So if you're over 65 and haven't received that yet, get that at the same time as your flu shot this year. So the flu vaccine and pneumococcal vaccine are available at local public health offices, nursing stations, physicians' offices, community clinics, and of course pharmacists can provide immunization services to people 7 years of age and older. Contact your healthcare provider before you go get your vaccine to ensure they have it available. And thanks again to all Manitobans, and happy to take some questions.
There's a focus in this year's campaign to go beyond just getting the flu shot, but also, diet and exercise. Why the intention this year to focus on that?
Well, I think that's always been an issue. We know there's so much more to to our health than just respiratory illness. We know there's many ways to stay healthy, and over these last 18 months, we've become so focused on one cause of ill health. We want to bring back the focus to overall health, mental health, physical health, and again, preparing Manitobans for a respiratory virus season that's somewhat uncertain. We don't know what things are going to look like with the influenza, so we want Manitobans to stay healthy and physically and mentally.
Last year, 31.6%, a record. What are we? Obviously, we're hoping for more. But what is the expectation? How much supply is being prepared?
Well, we've ordered a bit over 600,000 doses. So that includes the HD doses, the high dose doses. So we are prepared for a significant increase in that uptake. But we want to get as many Manitobans vaccinated as possible.
Do you know how many doses it was last year?
I don't know offhand exactly. Yeah.
Southern Hemisphere is often used as a bellwether for influenza season here. What have we seen so far?
Right, and so this makes, the predictability of the flu season is always challenging, right? So you're right, we often look to the Southern Hemisphere to get a clue on what's happening. It still isn't perfect. This year it's even more challenging because most of the COVID restrictions were still in place in the Southern Hemisphere. So we haven't seen a typical flu season there. So that adds to the uncertainty that we see. So we really want people to get that flu shot. We can't expect or rely on a flu season like we had last year.
How much space is there in ICU? Let's say we have, 10% more flu than we had last year, which we had a dozen cases. Just so people know, how dire it is in hospital and to get the vaccine.
Well, we've always said that our healthcare system has been under strain throughout this pandemic. It's still under strain because of the challenge from our second and third waves. And so, specific questions about the availability in the ICU, I'd prefer Shared Health to ask that. But, our health system is strained. We're trying to catch up on many delayed procedures through our second and third wave. So we just can't tolerate huge increases in ICU care.
And how do you make sure that people still have the flu in front of their minds? Because last year was pretty much non-existent.
Well, that's right, and so we're trying to ensure that people are aware. Last year people came out in record numbers to get that flu shot, so we want to encourage them to come out again this year. And then this year is different. We have the COVID vaccine. Because of that, we're having much more interaction between Manitobans now. Because we're able to, open up capacity limits because of people who are fully vaccinated. Those are still going to set us up for risk of transmission of other respiratory viruses like influenza. So influenza, we have an additional way to protect ourselves on top of the fundamentals, and that's that vaccine.
You do then anticipate, I know it's uncertain, you do anticipate there to be, a lot of instances of the flu this year. There wasn't any last year.
We have to plan for a significant respiratory virus season because last respiratory virus season we had very little interaction because of the public health orders. Right now, for the majority of Manitobans, we're interacting much more than we did last year because of that vaccine to COVID, which sets us up for transmission of the other respiratory pathogens.
The 600,000 doses you mentioned a second ago, is that expected to cover us for the whole season, or are you anticipating you'll order more at some point?
That's what we're anticipating for the season. Of course, things change, and there's always ability to try to seek more if required. But we'd be quite pleased if we had all those doses administered.
Are you hearing supply issues so far? I know there was some last year.
I haven't heard of any delays or supply issues at this point, so we've already distributed significant amounts. I don't have the exact numbers, but I'd encourage Manitobans, get in touch with your healthcare provider, see if they have the shot, and get that dose.
Just looking at ICU beds, Shared Health did say yesterday that there's a possibility we're going to move people away from Winnipeg to other health regions. What concern does that bring?
Well, the big issue is that the healthcare system is preparing to be able to respond to to increases, and so we want to ensure that all Manitobans are available to receive the care they need. And one of the best ways to do that is to ensure the person receiving the care is in sort of the right place in our system. So if there's high level acuity places that have low level acuity patients, we need to be able to shift and respond to that. So that's where that thinking is coming from.
Does that show the strain that Shared Health is saying this is bound to happen?
Well, I think it's showing more the preparation that we want to prepare and be prepared for any increases that we might see.
Flu or COVID? Sorry, flu or COVID?
Sure, respiratory virus for sure.
One more question on this time? Very good. All right, we'll get Minister Gordon prepared for his shot. We are, those are flu vaccine stickers.
Yeah, that's all the more reason to get one. Brent, do you want to move on to this?
Yeah. Maybe move the audio stand so that you can stand there.
The audio stand?
The microphone. That way.
Anything for you, Mike. Mr. Gordon?
All right, we can open it up to other questions at this point.
I've got 2 extra.
We now know of 176 workers, healthcare workers, who are not vaccinated and won't be tested and are on unpaid leave. 100 of whom, at least 100 who are in the Southern Health region. I'm just wondering, can you now tell us what sorts of jobs those people are doing, how it's impacting the region, and how long this is sustainable?
Well, I thank you for the question because it gives me an opportunity to announce that number is actually lower. It's 166 as of today. And so I thank all the healthcare workers that have stepped up to either become vaccinated or to agree to testing. The shared health and all the regions have been working very hard over the last few weeks to prepare. So at the moment, there are no service interruptions or staffing issues that need to be addressed.
Home care services have been suspended until further notice in the Winkler and Morgan area. Do you have any idea of how long that suspension will last? Is it related to the October 18th public health orders taking effect and people going on unpaid leave?
So we are continuing as an incident command team throughout shared health and all the regions to discuss any service interruptions, and so work is continuing in terms of services to individuals that may be at the community level.
And just, about the sustainability of this, I mean, it's a contingency plan, but it sounds like people are dug in and they're going to stay on unpaid leave, and how long can that last before they're terminated, or what happens with their positions?
So at the moment, they are on unpaid leave, and our job as a system is to continue to work with those individuals, as I said previously, to educate, to dispel the myths, remove the barriers and any challenges they have in terms of getting vaccinated or in terms of the testing. We're going to continue to do that work, and as we see the numbers coming down, it means that our contingency plans and our actions are working.
Thank you, Carol. Can we get somebody, does anybody else have any questions?
How long are you prepared to carry on with working with them and trying to convince people to comply?
Well, this has been week 1, and we are seeing results in terms of the numbers coming down, and we will decide as we go forward what steps we take, so long as we are able to maintain services and staffing levels and there are no service interruptions. Our goal is to continue to work with individuals who are still vaccine hesitant or testing hesitant.
You said you went from, I just want to get the number right, from 176 down to 167?
It is 166.
166?
As of today.
What happened with those workers? Are you saying?
Well, in some cases, there was some double counting occurring, so we've done a bit of recording error cleanup, and then in some instances, individuals are agreeing to be vaccinated or tested. So I'm deeply grateful to those individuals, and I know that all Manitobans are as well.
Do you have a number for that? How many have decided to get?
I don't have that here with me today.
Do you know which region? Sorry, just
Yeah, I'm sorry, I don't have that precise number.
So I understand your office has received a letter from the family of Alfred Jobsey. The family says he spent 12 of his last 18 hours alone in the ER because his family couldn't get in there. Have you seen this family's letter, and do you think the current policies around visitor access need to be reviewed?
So I can't discuss specific cases publicly due to privacy and of health information. If that letter is in my office, it will come to my attention, and we will take appropriate actions to address that specific issue.
But do you think that ER visitation and or having a family member support person there needs to be reviewed more generally?
You know, our policies are in a state of flux. They're changing depending on the COVID vaccine, the COVID pandemic, and what we're seeing in terms of the numbers. So we're always visiting and revisiting policies and guidelines. And if there's a need for a change, that will be done through shared health and the clinicians that identify that change needs to be made.
Mr. Gordon, Manitoba is the only province that's not keeping track of rapid tests. Why, are you satisfied with that? Why is that? We're told it's because it's resource intensive to track all the tests that are, rapid tests that are done. But Manitoba is the only province that isn't able to keep track of them. Is that okay with you?
So the distribution of the tests is done under the Ministry of Central Services. So that's my colleague Reg Helwer's department. And I do know that they do track the dissemination or the distribution of the test, and they do have that number. So I would refer you to them. But I do know that they keep track of distribution of tests.
Outside of that 166 number, and that's healthcare, do we know how many are refusing tests in other sectors like education?
We do have that number, but again, unfortunately, I don't have that with me.
And going back to the rapid tests for healthcare workers, since Monday, do you know how many rapid tests have led to positive cases where people have had to get the PCR test and miss work, and people who've agreed to be tested, and you've discovered, they have, potentially have COVID and need to get a further test?
I haven't been briefed on that, so I would say to my knowledge there hasn't been anyone. I would think that if something like that happened, I would be aware, but as of today, I've not received that information.
All right, folks, we've got time for a couple more questions here.
You think that the visibility of the protocols when they're tested might have an effect on the employees refusing to have those tests?
I'm sorry, can you clarify what you mean by the visibility?
Yeah, so the Union of Public Workers complained that the tests are too visible for their workers to take them on the workplace. Like they can be seen going into a room where they get tested. They can get the idea that they're not vaccinated. Do you think that can have an effect?
So I think that it varies depending on the facility. And yesterday in a meeting, I was actually advised that there was a change made in location of a testing location where it was actually moved into the chapel. So if that is brought to the attention of the manager or the facility, I'm certain that they would be able to make accommodations for the individual who may feel concerned about that.
We can do one more question, thank you.
I can't recall, sorry.
All right, thank you very much, folks.